Welcome to Micro Review. Today our topic of discussion is Clostridium botulinum. It causes a disease known as botulism. Botulism and botulinum, two similar words, would be easy to remember the disease. If we talk about the features of this particular bacteria, as I mentioned earlier, that all the Clostridial species have some features in common, like their anaerobic, spore forming and gram-positive rods. The habitat of this particular bacteria is soil, and it also contaminates the vegetables, fruits, seafood, and mainly improperly preserved canned food. If we talk about its transmission, it is transmitted in three different ways, which leads to three different types of botulism. If it is transmitted via the canned food, not all canned food is going to cause botulism. Those canned food that are improperly preserved will lead to botulism, which is known as adult or food botulism. If it is transmitted via the soil, contaminated soil containing the spores, and the wound is contaminated mainly, it would lead to wound botulism. And the third one, which is unique and important to know, it is also transmitted via contaminated honey. Honey, since it is given to infants, so if the honey is contaminated, it will lead to infant botulism. It is also known as floppy baby syndrome. Moving on to the pathogenesis of this particular bacteria, you should be remembering that Clostridium botulinum is producing a toxin known as botulinum toxin. It is absorbed from the gut, carried to the peripheral nerves via the blood, works at the neuromuscular junction, and cleaves the snare protein. When the snare protein is cleaved, it prevents the acetylcholine release, which was responsible for the muscle contraction. But now acetylcholine release is prevented, leading to a paralysis which is known as flaccid paralysis. One thing you have to remember, that in botulism there is flaccid paralysis. In tetanus there is spastic paralysis. These are the two important MCQs. Flaccid paralysis occurs in a descending manner. You should also know this. And one important point about this toxin is that it is having a lot of types. It is having 8 immunologic types. Whereas tetanospasmin, which was the toxin of Clostridium tetani, it is having only one type. On the other hand, botulinum toxin is having 8 immunologic types. Out of these 8 types, A, B, E are most common and important. This is an important point, that toxin is a polypeptide encoded by the lysogenic phase. If we talk about the uses of this toxin, since this toxin, botulinum toxin, is causing flaccid paralysis, it is used in Botox. B for botulinum, B for Botox. This is actually a commercial preparation of exotoxin A. Out of these 8 types, the A type is used for the removal of wrinkles from the face. Minute amount of toxin are useful in treating some spasmodic muscle contractions like torticollis, writer's cramp, and blepharospasm. Right? This is an embryological, this is writer's is hand related, this is eyelid related. If we talk about the types of botulism, there are 3 types of botulism: the food botulism, infant botulism, wound botulism. Wound botulism is via the infection with the spores of Clostridium botulinum. They germinate and the toxin is produced, and this whole mechanism occurs. Infant botulism, as I mentioned earlier, transmitted via the contaminated honey and leads to floppy baby syndrome. Now the question arises that the toxin is not ingested, only the spores are ingested and they grow in the infant intestine. Normally in adults, what happens is that the normal flora of the GIT competes with these spores and prevents the disease. But in baby, the normal flora of the gut is yet not properly developed, due to which floppy baby syndrome occurs. Moving on to our third type, which is the food botulism, which is important. It is the ingestion of toxin. It is not the ingestion of spores, which is occurring here or here. It is the ingestion of toxin, direct ingestion of toxin. This is an important point. What happens is that when the improperly preserved canned food is having spores inside it, the spores germinate in an anaerobic environment, leading to the formation of toxin. And we ingest a preformed toxin, which shows its effect immediately. The canned food like mushrooms, smoked fish, green beans, and peppers are the source of transmission. But we can prevent it in a way that if we cook it properly. If it is undercooked, it will lead to the disease. But if it is cooked, it will prevent from the disease. Right? If we talk about the symptoms of this particular disease, so you have to remember 3 Ds. Diplopia, dysphagia, dysphonia. This is a type of mnemonic. Difficulty in swallowing, difficulty in speaking, double vision. And as I mentioned earlier, it leads to a paralysis which is known as flaccid paralysis, which is in a descending manner, and no fever occurs. If we talk about the diagnosis, so it is a clinical diagnosis mainly. Sometimes spores and toxins are detected in the stool or food. And these are just some points written that toxin detection involves serology or production of disease in the mice. Serology for antibody is not useful, not that much important. Only you should know that the diagnosis is clinical and spores and toxins are sometimes detected in stool or food. If we talk about the treatment, you have to give the antitoxin. And now the antitoxin that is preferred is hepavalent antitoxin, which is containing all types, over the trivalent. The trivalent is not preferred, hepavalent is preferred. Antitoxin, as I mentioned earlier, the mechanism of action of antitoxin is just to bind to the circulating toxin and prevent its passage towards the neuromuscular junction so that it cannot perform its action and it cannot reach the neuromuscular junction. It is just going to affect the circulating toxin. It has no effect on that toxin that has already started to perform. And we have to give supportive care mainly because respiratory support, any sort of problem in the respiration would lead to death. So first of all, we have to give the respiratory support. In case of infant botulism, what we do is that a bivalent antitoxin which contains the AB types. As I mentioned earlier, it is having 8 immunologic types, out of which A, B, E are most important. A was used in the Botox commercial preparation, right, to remove wrinkles from the face. But this type, A and B type, is used in the bivalent antitoxin. Immunized with the botulinum toxide is used in the infant botulism. This is whole about the Clostridium botulinum. To summarize this particular topic, you should be remembering it causes botulism, transmitted mainly via the canned food. It is also transmitted via honey, leading to floppy baby syndrome. It is having a mechanism of action that it is absorbed from the gut, goes towards the neuromuscular junction, prevents the acetylcholine release, leads to flaccid paralysis and in a descending manner. This toxin is having 8 immunologic types. Its uses are mainly in the Botox, B for Botox, B for botulism, and 3 types: food, infant, wound. I have discussed the mechanism and its prevention. I forgot to discuss that it is prevented by proper food sterilization, proper food cooking, discarding bulging can. Any sort of can that has been swelled due to gases, and those gases are produced due to clostridial proteolytic enzymes. So you have to just discard those cans and properly cook the food, properly sterilize the food. The symptoms are 12 to 48 hours after ingestion, and the symptoms are descending paralysis, all the 3 Ds. You have to remember the diagnosis is clinical, treatment is antitoxin, respiratory support, and a bivalent antitoxin in case of infant botulism.